Welcome back. It is exactly 1 minute to 10 o'clock on this Wednesday, November the 18th. This is Jeff Koinange live with the Cabinet Secretary for Health, Mutahi Kagwe, live in the house. This is great to see you, sir.
Thank you very much.
Karibu sana.
Asante
and
sana.
Thanks for your time. I know you're busy. I know you're crunching numbers and dealing with numbers and being hit left, right, and center. But the fact that you've come to the show, you've come to speak, I really appreciate that.
Thank you very much.
And look, see, yes, the numbers are numbing. Not just Kenya, but globally. The numbers are numbing. We're hearing what? 1.3 million deaths so far in the world? Well, put that in perspective for a moment for me.
Okay, first of all, Jeff, thank you so much for inviting me here tonight. And yes, I am busy, but it's always a pleasure to be with you. Let the people know we've been friends for a long time.
A long time.
So,
really? Oh,
it's good to see you. Yeah, it's good. I see you get it. So good. It's good to see you.
Yes.
And I want to thank Kenyans, and I want to thank God. I want to thank everybody for the support that they have given, even during this very difficult time. And you said it. It's a very trying experience. When the figure you said just now, 1.3 million people dead. Now, it is difficult to put some perspective into this. Remember, the population of Mombasa is 1.29 people, 1.29 million people. In other words, the number of dead people today, just COVID alone, would have wiped out the entire Mombasa, man, woman, and child.
Good Lord.
Look at it another way. The United States, as of today, reported 254,000 people dead.
Yep.
Now, when you think about it, I come from a constituency called Mukurweini. The population of Mukurweini is about 80,000 people. So take Mukurweini, take Tetu, take Othaya, and you are still below the number of people dead. In other words, if you don't have any man, woman, or child in those three constituencies, that's the number of people dead. In one country only, the United States. So what we are saying here, Jeff, is that we are living in totally unusual times. We have a pandemic in our midst, and it's good to be very careful. While still, we have no idea what tomorrow brings.
And yet, Waziri, despite what you just said, and this is mind-boggling, Mombasa wiped out.
That's correct.
Mukurweini, Tetu, Othaya wiped out.
Just the US, just the US
alone.
figures.
So why are we dancing with death? Why do we play with death every day? What is it that we don't get?
I think to me it appears like denial. It's like denying that this thing is here with us. It's like refusing to accept that we have a situation. But having said that, let's also agree that Kenyans, by and large, have actually been careful. That's why the figures that we are talking about don't quite relate to us in our country so far. With about 1,300 people dead, and that's one too many. That's one too many. But nonetheless, when you think about it, our positivity rate, in other words, the number of positive cases as opposed to number of tested, still stands at about 1.8%. Yeah. Our death rate stands at about 1.8%. While if you look at, for example, the figures that I just mentioned in the US, stands at about 5.2%. So we are still operating at a fairly low figure, given the global experience that we are watching and seeing. So I think Kenyans by and large are beginning to see that this thing is not a joke anymore. It used to be, Jeff, people would say that, do you know anybody who has ever gotten COVID? Right. Do you know anybody who has ever died of COVID? Jeff, I think you and I know very well. And perhaps a beginning point for this, you got COVID.
Yes, I did. I did.
You went through a very difficult time.
It was tough.
And tell me about that.
Well, look, I've never had any hallucinations in my life. And I was hallucinating in the middle of the night. And I was wondering, who is this who's stepping on my chest? Honestly, in the middle of the night, who is this who's pressing down on my chest? And I remember I was awake, but I couldn't scream, or I couldn't shout, or I couldn't ask for help, because I felt like someone was really pressing down on my... Honestly,
And that's because, you have got difficulties breathing.
Yes.
Because your lungs are flooded
Yes.
with liquid and fluid, and that's why people can't breathe.
And other people had it even worse than me.
Yes, look at the government spokesman. Oguna explained
yes.
to us about the experience he went through.
Yeah.
And there are so many cases like that. So many of our friends, have fallen prey to this pandemic. And the point is that, I have said this, Jeff, and it's become sort of like both a message and a joke, that you can get it and I can get it.
Yes.
Anybody can get it. And this is a fact. This is a fact. There is nobody who is safe from this disease.
And why are people still in bars? Yes, the curfew was was driven back an hour, or brought back an hour. But it's unfathomable that people are flooding in bars and then rushing home.
Well, it's like this. As I said, I think, to me, in terms of just behavioral science, I think first and foremost is denial. People are still denying it to themselves, because accepting that is there means you have to have a serious change of behavior. And people don't want to change behavior. You are used to going to your local Karomaindo. You still think, if I don't go to my local Karomaindo, what else do I do? I mean, Jeff, we have had strange stories of people who could not go home, and some of them were actually in their own houses, and woke up and lift and take their jackets and say, I'm going home now. Because they're so used to not being there.
Yes.
So I think it's a challenge for a lot of people. It's a challenge to see, what do I do? The second thing is that obviously people naturally enjoy socializing. This is denying us socializing. Having said that, a lot of people are staying at home. Yes, people are going to pubs, and of course, and we are watching this situation. As you very well know, we closed pubs, we stopped the sale of alcohol at some point. And as the president has repeatedly said, we watch the situation and see when to escalate and when to de-escalate mitigation measures that we must take in order for us to beat this virus. And so far, I want to do two things. I want, one, to thank Kenyans, and secondly, to encourage them. Because you see, Jeff, the problem with this disease, the problem with this virus, is that once you have it, you are not just a threat to yourself. You are a threat to your kids. And your kids are a threat to you. So I think it's best to look at this thing and say to yourself, there is a time for everything, as the Bible says. There's a time for everything. This is a time for us to withdraw from socializing, for us to withdraw from funerals, withdraw from political gatherings, withdraw from weddings, and essentially stay away for a while. It will change, and then we can go back to our normal behavior.
Let's switch gears here for a moment, Waziri. And you saw earlier on the cry of the medics in front of the Senate, the House. It brought the House to tears. And you're the minister in charge of health. How does that make you feel? Well,
two things. First and foremost, I know what we have done for the medics. You said, as you rightly said, I am the Minister for Health. I'm the Cabinet Secretary for Health. So I know what we have done for medics. I know what is theory, and I know what is practice. First and foremost, for me, there is no category of people at the moment who I consider more seriously, whose case I consider more seriously than that of the health workers. For very good reasons. In a war, Jeff, people die, children get bombed, women get bombed, but by the end of the day, we still have to have special care for our soldiers, because they are the ones who protect even those who live. So for me, it's very important that we do that we protect our health workers. Having said that, I think it is also important for us to appreciate that health workers are part and parcel of our communities. Health workers don't live somewhere separately. They live with us. So they will be infected just like the rest of us. And there's nothing anybody can do about that. The important thing is to protect our health workers so that they do not get infected in the hospital when they are treating our people. And if indeed they were to fall sick, we know what to do for them so that we can facilitate quick recovery. Now, the issue that has been in the newspapers a lot, in the media, is the issue of the health cover. Effective the 1st of October, all civil servants, not just, and you saw it today, it was in the newspaper, in the news today, effective the 1st of October, all civil servants have got a better cover than they have ever had before. Than ever before. In terms of the benefits, that the cover that the NHIF has drawn out from the 1st of October, which they announced today, is a better cover than has ever been there before. And I can guarantee you that, Jeff. Secondly, in terms of body protection, we have said we want to ensure that every single doctor, every single nurse is properly protected with the PPEs and personal protection equipment. That is the gowns, that is the suits, that's everything that they need, they get.
You guaranteeing that?
I can guarantee that as sure as night follows day. Because I know we have got 300,000 PPEs at KEMSA. We have said that even though KEMSA bought them at a higher price because of what was happening at that time, we have said going forward, any county with any shortage of PPEs can draw any quantity that they need from KEMSA.
So you're saying the ones we hear that are in the warehouses, the counties can get?
Yes, counties are free to get them anytime. So Jeff, let's separate two things. Let's separate the issue of management, where perhaps logistically you are not able to find out and to know that your people do not have PPEs, and the idea that PPEs are not there in the country. We have more than enough PPEs in the country. In fact, our local manufacturers are exporting PPEs. So it's not a question of availability. They are there. It's not a question of money, because we have given counties money to do all the things that they need to do. It's not even a question of money, because they can draw from KEMSA anyway, and then we can get the money from the national government. So what we are saying is that let's separate the issues here. An issue of logistics and an issue of shortage. That's number one. Number two, there are issues that the doctors are talking about. And I want to separate the issues. There are COVID-related issues and non-COVID related issues. When it comes to the COVID-related issues, and this is what I said to the union when I met them the other day, I said to them, listen, I want to deal with COVID-related issues. When it comes to non-COVID related issues, everybody in Kenya is sacrificing one way or another. This company called Citizen is sacrificing. The employees of this company are sacrificing. Some of them are on half salary, you know, in most organizations. And they are taking pay cuts and they are doing whatever they need. So this is not the time, in my view, to start saying that I want more money. You know, this is not the time. Let us first of all secure ourselves. Let's secure the country. Let us make sure that doctors and nurses are not suffering, at least in the workplace. Let's make sure that what is due to them is paid, you know. But for now, let's focus on saving lives.
You mentioned a moment ago manageability. Have we managed this virus correctly, in your opinion?
I think that the results speak for themselves. And I want to say, Jeff, that I claim that I do not claim that that is as a result of Mutahi Kagwe. That is as a result of, first of all, very hard-working medical staff, extremely in such a sacrificing manner. You know, these people worked day and night. And Jeff, let's not forget that we started off at a time when this pandemic, nobody knew anything about it. So we were all shooting in the dark. But I think that some of the steps that we decided on from the beginning, the quarantining, the cessation of movements, all those things prevented us from being medically overrun. That was the biggest single handle. So that the disease growth was growing at a pace that we were also able to be growing the medical facilities, making isolation beds, creating more capacity for ICUs, even in regional hospitals and other places. So that was the whole idea. And I think we managed to get that. Don't forget that at that time, what was happening in places like Italy is that they would not be able to cope with just the people coming to the hospitals. So in places like Ecuador, they would simply watch people die, put them in the streets, pour petrol on them, and burn them because you can't even take them to a mortuary. So the fact that we did not get, a curve so steep that it was overrunning our health facilities, and if the curve had gone that way in the month of March, in the month of April, in the month of May, Jeff, we would not have been able to cope with it.
Tell me something. The numbers that we have, you're talking about the numbers, and look, if the doctors were listening to you right now, if they're watching you, they're probably watching you on that camera.
Oh, I'm sure they are.
What would you tell them? What would you tell the doctors right now?
Well, first of all, thank them. Is the first thing that I would do. I would thank them. I would say, guys, you have done a fantastic job. Let's not mess it up now. All right? We will do everything we can for you. And it's not just the doctors. Let's not forget this. In fact, the very, very front line are actually the nurses and the clinical officers, and all other staff who work in laboratories, who are handling in labs. They're handling this virus, and wearing gear because a small mistake means that they contract the virus. So let's not say doctors. Let us say the health workers. People in pharmacies, people in labs, clinic officers, people who come to you, Jeff, and do your sampling. They come and sample you.
Correct.
These people can get infected anytime. So what we are talking about is a medical fraternity in our country. And they have done a fantastic job. And it's a pity that we are losing some. But having said that, if you look at the global statistics, and you don't want to get there, you'll find that, for example, in a place like Italy, 10% of the cases, reported deaths in Italy are actually medical personnel. We are nowhere near anything like that.
Tell me something, Waziri. Are the hospitals full? We keep hearing, are the hospitals full or ICUs? Are they full?
No, they're not. Let me tell you what is full. Aga Khan may be full. Nairobi Hospital may be full. Even Mpisha may be full because their capacity is very small. When you talk about famous hospitals like Nairobi Hospital, and you ask yourself, especially before the new 100-bed capacity, for the UN that we opened just the other day, the president came to launch it the other day. Before then, they had something like 77 beds. Okay? Aga Khan has about 56 beds. So, and that's not for COVID. That's for everything. So when you hear that the hospitals are full, it isn't that the whole country. If you go to Embu has got a fantastic facility, both HDU and ICU. They have got maybe 2 people in them. If you go to KU, here in Kenyatta University, teaching in the Faro Hospital, they are nowhere near full. Yesterday, I was talking to Evans Kamori, CEO of Kenyatta Hospital. Bagathi is not full. So what we are saying, you see, in your mind and in the minds of most of the middle class in our country, there are 3 hospitals. Yeah. Or 4 hospitals. Yeah. In other words, the few private hospitals. But as far as the public hospitals are concerned, I think we need to grow new confidence in our public institutions and to accept that if you fall sick, then you might have to go to a public institution. It is not always a private institution. And we are making all sorts of changes in public hospitals. If you look at KU, for example, for the first time, we have got private hospitals referring people for one procedure or another to a public hospital. So I think Kenyans need to understand that going forward, we will probably get to the point where the public hospitals will be just as good as the private hospitals, if not better.
Okay, so since September, let's face it, since September when the lockdown was relaxed, the numbers have shot up.
That is correct.
In places like UK, in France, in Italy, they're all going back to lockdown.
That is correct.
Because their numbers are rising. Are we going to go? I know it's not your decision, but you will influence the decision. Is it time to lock down again, to go back to that?
I think that decision, as you rightly said, is not a singular decision. We make decisions based on science, not based on a gut feeling. And yes, one might say, let's go for lockdown. First of all, let me remind you that we have never done anything called a lockdown as such, where you essentially tell people to stay in their houses and not to come out. We haven't done that yet. And we have always had this balance between economic activities in the country and also the health activities in the country, health protection in the country. Because, Jeff, you must remember that it is quite easy for you, in the process of trying to solve a problem, to create a bigger problem than the one you are trying to solve. And you must also therefore have that balance where you don't want to create a bigger problem than the one you are trying to solve. So what in the mind of the UK, for example, what is a lockdown in the UK is impossible in our environment. That cannot be. It cannot happen because of the circumstances and social structures that exist in our country. So what is possible here is the kind of measures that we have taken. We de-escalate issues, we escalate issues, depending on what we weigh. When you have got, for example, essentially community spread, you look at two things. You look at A, the fatality rate. How is that going relative to what would happen if you actually had a lockdown? And B, you look at what is happening in the hospitals. Are you near being overrun in the hospitals? So for instance, if you go to Embu and you see the figures are there, but when you look at the hospital, and I'm just giving Embu as an example, or Mombasa for that matter, you know, these are the considerations that you make. And then you ask yourself, if we cease complete economic activity, what happens in 2 months' time after the ceasing of the economic activity? All right? And sometimes you are torn in between those decisions. Having said that, as you notice, we have taken some measures already. But the most important measure that we should take as a community is to observe the rules. If we observe the rules, Jeff, it would not be necessary to take any, or to de-escalate any measures.
But we don't observe the rules. Let's face it, we don't care. We don't observe the rules.
That is a problem. And because of that, that's why you bring back curfew, you know, so that people can go home earlier. And if you notice that it is not working, then you take further measures, as we have done in the past, and we have done it. So currently, we are watching the situation. You rightly said that from September, indeed, since July, our positivity rate in September was down to between 4 and 5%. All right, out of all the people we tested, only about 4 or 5% of them would turn out as positive. This week, we have yo-yoed between 14, 16, 17%, with an average of about 15%. Today, for example, we had a positivity rate of about 15%. So you weigh that figure. As soon as it starts going down, then you can de-escalate some of the things that you have escalated. So we are watching the situation. Our scientists are working at it. We are modeling the situation. We watch from place to place. And then we have learned a lot of things since March. For example, in terms of managing it, we have learned that you don't have to close the entire country. If there are areas that do not have many big issues, you don't have to close them because you're closing Nairobi. And if you remember from the beginning, the original position that we took, first of all, we closed Mombasa, we closed Kilifi, Kwale, we then closed some areas like Isli that were very bad at the time, and there is nothing to stop us from taking such measures once we see that this is what is happening. It is for that reason that we have said, Jeff, that we have got the committees, COVID committees in every county. And we have said the COVID committees, which are chaired by the governor and the county commissioner, to immediately, we have these emergency meetings to tell us what they see in their counties, what measures they think we should take in the counties, because different counties are facing different attack rates.
The festive season is literally around the corner. Today is the 18th of November, so in a month's time, we're into the Christmas period. And you know what happens during the festive season. What's the plan of action? Are you going to institute those measures you just said? You may be forced to?
Well, Jeff, I think you hit the nail on the head when you said, are we going to be forced to? So if we are forced to, then we will have no choice. But if you are not forced to, in other words, if by that time people are behaving and the figures are beginning to calm down, then you don't have to. But can I say that we just wait and see?
No, because we're 2 weeks away from December. We're 2 weeks away.
Well, we are 2 weeks away from December. A lot happens in 14 days in COVID cases. A lot happens in 14 days. And if today, for example, it takes about 14 days to find out, as you well know, what your situation is. If today people decided in 14 days, we are going to bring down this disease, it would come down. So I keep hoping, but we will never shy away from taking whatever decisions we need to make. So if obviously the cases are going up, and we think that by allowing people to travel, it is going to cause a problem, then we have done it before. We can do it again.
Look, you seem very optimistic about Kenyans, Waziri. I mean, every time you call a press conference and you say the last 24 hours, does it come a point where you tell yourself, who am I fooling? These people, they don't mask up, they don't sanitize, they don't care, or they don't seem to care.
Well, Jeff, I never feel like that. I'll tell you why I never feel like that. Because if you can save 5 lives, it's worth it. It's worth it. If you can save 1 life, it's worth it. So yes, there will be those who will always say, or who will always ignore, and you have heard them say, there is actually no COVID. And you know people who have said there is no COVID.
Yeah.
And 2 weeks later.
To this day, yes.
And 2 weeks later, they are in with COVID.
Yes.
So the point is, you cannot sacrifice those Kenyans who are willing and able and who are taking decisions to save themselves. You cannot sacrifice them under the altar of the Kenyans who are not doing so.
Look, in the beginning, you seemed like the face of this pandemic. And everybody said, Kagwe is the guy. You had the confidence of the nation. And then along came KEMSA and the whole mess behind it. And maybe Kenyans lost confidence. Maybe they said, you know what? Hii ni pesa yetu wanakula. And I'm sure you've heard that yourself. How do you reassure? How do you tell Kenya, okay, yes, there's money stolen there, obviously. There's some controversy. It's under investigation and all that. How do you reassure Kenyans that, I got you guys. We're on the right track?
I think you must remember one thing, Jeff, that this whole thing is in the background of a lot of skepticism by people for good reasons and for reasonable reasons, so to speak. And I think that I don't agree with you that essentially then because of KEMSA, then everybody loses confidence in you. There is a lot more to the Ministry of Health and health issues and KEMSA. That's number one. Number two, I think it became very clear, and we have explained it point by point by point, exactly what was happening at KEMSA. We have also explained very clearly the steps that we are taking, including the fact that as we speak, there is a whole lot of people who have been suspended from KEMSA. There is investigations that have been going on at KEMSA. There is new ways of management that we have introduced, including e-procurement. And let's never forget, Jeff, the people who came to investigate KEMSA did not come from nowhere. I invited them to come and investigate KEMSA. Even within the Ministry of Health, as we speak, I have invited some people from DCI to look at some of the operations that are going on in there. So I think we must never lose sight. How are these things happening? These things are happening because we intend, as a ministry, we intend to clean up what has been known before as Mafia House and bring it back to Afya House. So the fact that we are the ones who are introducing these measures, the fact that I am the one who is calling these people to come and carry out investigations, to me, should create confidence, not lack of confidence.
Do you feel like, this job is not really worth it? Because what you go through on a daily, I'm sure your emails, your inboxes, social media,
Jeff, and I want to repeat to you, what is the business of health? The business of my ministry is to put a smile on a patient's face. That's my job, all right? And if I can put a smile on a patient's face, if Jeff Koinange can come back to Jeff Koinange life, way from the COVID-19 and recover and sit here with me, let me tell you, it's so worth it. I don't feel what you're saying. And by the way, there's an old adage in English. If the kitchen gets too hot, you get out.
Get out the kitchen.
Absolutely. So as far as I'm concerned, it's not hot enough yet for me to get out. I like my job.
Yeah.
I like what I'm doing.
Yeah.
I have got so much that I want to do in terms of provision of healthcare to Kenyans. The day that patients are walking out of hospitals, able to pay for themselves, or there is an insurance that is paying for them, there is a doctor who smiles at them, there is a doctor who makes them feel good, there is a nurse who smiles when the patients come in. That's the job. And once that is happening, great. That's what we are supposed to be doing.
Yeah.
Jeff, everything that we do, including my being here with you today, there is a means to an end. The end is proper healthcare for Kenyans.
And you're certified, you're confident Kenyans will get that healthcare.
I'm totally confident. Otherwise, I won't be here. I won't be here. This is not something, Jeff, this is not something that happens overnight. You know, what you must remember is this. You must create the base that is going to ensure that this thing is sustainable. You don't go there and shoot from the hip and then, you know, the day you are not there, nothing happens. You must lay a foundation that ensures that even if you are not there, the whole thing can still continue and Kenyans will still get good healthcare.
Okay, speaking of healthcare, universal healthcare, I want to talk about that after the break. Waziri, what's the deal now? If Kenyans want to go for COVID test, universal healthcare wouldn't take, NHIF wouldn't take of it. It wouldn't take care of it. I mean, what does that mean? How do they pay? Out of pocket? And this universal healthcare you talk about as well, where are we going with that? And I know you have a lot of questions for Health Cabinet Secretary Mutahi Kagwe. I know you do.
That's why I'm here.
I get it now. Keep tweeting at Koinange Jeff, at Citizen TV Kenya. The hashtag is JKLive, and we'll go to your questions. We'll go to the wall in a moment. Meantime, Jeff Koinange Live takes a break. We'll be back in a moment.